Scott County, providing safe, healthy, and livable communities.
Chris, I'm going to turn it over to you, and you're going to work on our Scott Delivers topic for today.
Good morning, Mr. Chairman, Commissioners. As the Chairman said, Leslie had a last-minute safety of travel plans, so when she was unable to be here this morning, she asked me to help facilitate this conversation. I work as a child protection supervisor here in Scott County, and I also do a little bit of work on the broader Scott County Delivers team. We're going to move through this Scott County Delivers presentation this morning like we've moved through the rest of them. I'm going to ask the members of the panel to introduce themselves briefly, and then I'm going to ask Danielle Fox, who's the manager, to do a little overview of the discussion. We're going to have do some introductions, and then we're going to move pretty quickly to the data slides and start talking about that. So with that, can I ask you to introduce yourself?
Sure, thank you. I'm Jay Cruising, the County Library Director.
Hi, I'm Jen Schwartz, HHS Admin Services Director.
I'm Brad Davis, Planning Manager.
Terry Steer, Detective Sergeant, Bell Plain Police.
John Buteau, Sergeant Investigations for Shakopee Police Department.
Brittany Schmidt, Public Health Nurse.
Beth Mahoney, today the Intake Supervisor.
Brittany Bussey, Supervisor of Adult Protection.
Good morning, everybody. I'm Danielle Fox. I'm the Adult Services Manager for Health and Human Services, and I get to kick us off today. I'll do a brief introduction of what we're going to talk about, and then I will hand it off to each one of our individual panel members to talk a little bit about their role and give me key highlights as well. This is a group that has been meeting ongoing, typically every other month, which I'm happy to say is a best practice that's developed across the state. Not every county has this, but these are several of our key members to our interdisciplinary team. So their team comes together and they talk about policies and procedures, they talk about best practices, they do case consultations, and really is an excellent opportunity for us to just continue to engage in partnership so that we're developing and maintaining quality services here in Scott County. So I thank them all for being here today and for their continued commitment to that interdisciplinary team. Some common themes that you'll hear today are growth. We have seen an exceptional amount of growth in the need for adult protection services, which we have requested an additional staff person in part of the 2018 budget, which commissioners have seen. You will also see improvement as a common theme. This group has really been key at identifying and taking part in trainings to increase our ability to respond to community needs, consulting with some of our other county partners in the metro area and outstate Minnesota to learn from them. Collaboration, which this group is key to overall improve and to ensure that we are protecting the vulnerable adults in Scott County. We have seen an incredible increase in the need for investigative services. In 2011, we had 16 cases for investigation, and so far in 2017, we have 122. So it's been pretty rapid, and as a result of that, we have our investigators in the audience with us, Jennifer and Brianna, who have seen the direct impact of that. But across the metro, we're seeing caseloads for investigators range from about 12 to 15 cases at any given time. Right now, these guys are dealing with caseloads of 22 to 24. So that's a significant amount of work that they're processing. They do an excellent job and are extremely committed to their work, so we thank them for that. We are attributing this growth to a number of things. I think we've overall just seen a general population increase in Scott County. We are also seeing our population aging, and so there are higher needs there. And then a couple of years ago, the state implemented a central intake line, which has resulted in a lot more utilization of investigative services. So in the past, each county had their own phone number that they would call and make a report. This has now been statewide. There's one number. They did a campaign across the state to provide some education to citizens and to key members of the community who can identify and report abuse. So we've definitely seen an increase in numbers. We have also, I think, seen an increase in complexity and severity of cases, and so you'll hear that today from these folks. And with that, I will kick it off to Brittany.
So again, my name is Brittany Bussey. I supervise the adult protection team. Currently, there are 2 investigators that make up our team. We're looking for a third. As Danielle talked about, we have just seen a significant amount of growth in a fairly short period of time. But with that growth, we've also seen a tremendous amount of change. Just internally, how we are screening the reports that we're receiving through this MARC system, which is the central reporting number. And again, just the MARC coming to be in 2015, that was a significant change where our intake staff were no longer engaging with the reporter and asking questions about the maltreatment they were reporting. Rather, the central reporting center is now receiving the reports, and we are only receiving the reports from the central reporting center. So it changes the dynamics of the work that we do. But I believe the investigation work that we're doing has improved significantly over the last few years, and that will be reflected in the numbers that we share with you in a moment.
Yeah, so as Brittany and Danielle had both mentioned, prior to 2015, we had folks on the phones all day long taking calls from community members, facilities regarding adult abuse or potential adult abuse. And when that change happened in 15, suddenly what our role is in the morning, we take off of a computer reports that we bring to our screening team, and the first time we've seen them is when we present them to their team, which we've done a little bit of extended screens just because we want to get additional information. Sometimes those reports aren't particularly thorough. Another change with that was, though, about that time, I think, that you guys started coming to the screening meetings as well. And we identified a few things that we had been doing as a screening team that were more probably in keeping with child protection versus adult protection. And so they brought a really nice complement to the team in terms of, the reports that we were screening in changed a little bit. And we just hadn't been as skilled, I think, as what you guys were at that time. So, I mean, there's been some changes in terms of the screening. I'm just trying to think if there was anything else I wanted to say. Oh, and then at the point that we screen them in, we go back to the computer and put in information that will give us information in terms of what the response times are, the structured decision-making tools. And so that's our role.
Public health comes into play when there's specifically a public health nuisance, specifically hoarding. And the calls that we've received for hoarding have at least doubled. And I think this is partially due to the aging population, as well as the fact that in May of 2013, hoarding disorder became a standalone diagnosis. And I also would attribute a lot of the awareness and recognition of this problem to the TV shows that have come out. So public health can go out and we can identify the risks to both the resident as well as the general public. And we see this as an issue for the public in terms of our first responders who might be going into these homes. They're really unsafe. And so I also chair the Minnesota Hoarding Task Force, and so I'm hoping to bring some of that knowledge here and in terms of best practice and how to address these homes, and it really requires a multidisciplinary approach. So we kind of have one phrase that we use to characterize it is that it's a mental health issue with public health and safety implications. So that's how public health is involved.
John Buto again, I'm with Shakopee Police Department. The law enforcement role here, I think over the last couple of years, our department and other departments in the county here, we've established a close working relationship, but we're on several committees with child protection, adult protection. Specifically myself, I attend the screenings for child and adult protection as often as I can. I was there this morning. It allows us to have an input. Some of these cases that are referred to Scott County come directly from my department. Some of them are coming from different entities, different reporters, but it allows us to have, input, and also I can see what's coming down, from Scott County to our office. In law enforcement, we've seen a drastic increase in all types of fraud. Our violent crime seems to be dropping, but our fraud cases are drastically increasing. And one of those is obviously with vulnerable adults being the victims of different types of frauds. So, you know, my role has been, you know, working with the investigators. You guys have a couple of very great investigators, and they work very hard. We have a close working relationship. They know all of our investigators very well. So my input, and I think, and along with the investigators, we have that close working relationship where no matter what case comes up, we can address. And I think that's been developed through attending these screenings and being on these committees. I guess that's probably all I have at this time.
Okay, I'll just go off of what, Terry Steer, Detective Sergeant, Belle Plaine. Go off of what Detective Butelier said. Our increase in mark reporting has gone through the roof. We have the Lutheran Home in Belle Plaine, so if we have a fall, that is now going to mark and coming back to us. So our increase is way up there as far as investigations go, and we're working with Adult Protection, and the two you have right now are great. They help us through investigations. They obtain all financial records, banking records, health records, which we can't obtain without a search warrant. So it's we partner with them, and our investigation times have increased to these cases where you're looking months out before you get all your documents together, and then you come out with a decision. So it's long investigations.
Great, thank you. Could we turn it over to the panel for some questions about the written materials that the folks provided?
I'm wondering maybe if, before we get into some of the questions, can you just walk us through, I know there's probably not a typical situation, but when you receive a report, you believe it's substantiated, or I'm not sure what the proper language was, but what happens next, and how do you ensure that that adult is then safe going forward? I'm just kind of curious what the process is and what parts you play in that.
Sure. So a report is called into MARC, which is the central reporting center. It comes into our intake center here at Scott County. We meet every morning to screen the reports. So to screen a report, it has to meet certain criteria in order for Adult Protection to have any legal authority to get involved. So that we have to determine that the person actually meets the vulnerable adult criteria and that the maltreatment criteria is also met. So if we can identify from the report or from an extended screening by calling back and getting a little bit more information, then we'll make a decision whether to screen in or screen out the report. Once it's been screened in, we either have 24 hours or 72 hours to begin an investigation, just depending on the nature of the allegation. And then the investigators, Jen and Brianna, typically would start by contacting the reporter. If law enforcement has been included on that report, they'd make contact with law enforcement just to begin to gather evidence or just to find out more what is going on with this report. But then they get out and meet with that vulnerable adult as quickly as possible, and then try to identify what are the safety issues here. And if there are any that need to be addressed, then they're working on those right at that first visit. That could be partnering with some of our other units here, such as referring them for a Min Choices assessment to determine if some additional home care services could be of benefit. So it's very case specific, but just to, did that answer your question?
Yep.
Okay.
Well, I can jump in on page 4, please, Deb. In the text here to the left of this measure, you state the hope is that vulnerable adults never again experience maltreatment. And the numbers are great. The last 3 of the last 4 years on this chart anyway, exceeding the high performance standard. But is there a mechanism for beyond the 6-month mark? That if the hope is they're never victim of maltreatment again, and we're tracking within 6 months, is there a mechanism for tracking beyond 6 months?
There is not at this point. This is a data set that's defined by the Department of Human Services, and so it's one of the goals that they put forward in Health and Human Services overall. So at this point, we're not measuring if somebody is experiencing abuse 12 months or 18 months or 24 months down the road. I think we can also speak to the fact that You see in 12, 13, 14, we're at 100%, and 15, we're going down to 94%. I think we can attribute that to a number of things, certainly the volume that we've experienced, but also, as Brittany talked about, the changes in policy and procedures in evaluating and doing those investigations. And we believe we have been completing much more thorough investigations. And so by substantiating an abuse allegation, you're going to see that percentage decrease.
Question I had on this is the maltreatment. Is this physical abuse, or is this someone that was a victim of fraud and then within that past 6 months they weren't a victim of fraud?
That's a great question. It could be any of the, any type of abuse, so neglect or financial exploitation. So any of those things are what we would be monitoring to see if that has occurred again.
But have you been able to kind of screen over time that a person that maybe is physically abused might be more vulnerable to a repeat than someone that has been a victim of fraud and then presumably won't fall for that fraud again?
Mm-hmm. I don't think we've made that connection yet at this point. I think this data to us is relatively fresh, and so we haven't gone that in depth of it to see if there's a connection there.
Mm-hmm.
The other question this raised for me is, what about repeated unsubstantiated allegations? So this is the substantiated abuse allegations. Do you have a mechanism, or formally or informally, of tracking sort of are there repeat unsubstantiated allegations?
Sure. I mean, there's a way we could informally track that. Any report that comes into us, it's logged into our system, so we could go back and look and see, you know, how many calls have we received about this person, what has our screening decision been. So we could go back and take a look at that.
So if there's a cause for concern, you've seen, okay, 3, 4, 5 unsubstantiated,
Yeah.
you'd have some record of that to look a little more closely.
And then we can use that historical data then for making a decision on whether to investigate on a new report that comes in.
Sure.
Some of that has kind of been prohibited based on our priorities that we have to set. So occasionally we'll get calls from somebody in the community who they might not meet the level of needing an investigation, but you can tell there's something going on there. They need some support. We refer to that as an adult service case. Right now our investigators have been so bogged down with the investigations, they have been able to do less of that and actually haven't done adult service cases for about a year at this point.
Well, the statistics around the aging population are pretty staggering that you lay out, as we're going to continue here over the next, dozen plus years. This number is going to continue to grow. How does the financial piece correlate? In other words, as your cases grow, will the finance or the grants or whatever come in to cover that, or are we going to see a gap that we're going to have to address?
We don't anticipate any additional funding coming our way to address that need, but we've certainly seen the trend of that population and the trend of our community needs go up because of that. I think we've also seen a trend in certain types of investigations that we're completing. For one, financial exploitation, as law enforcement referred to, we're seeing a lot more of that. Those cases, which you can see in the data around the increases there, tend to be incredibly time intensive. It's a lot of work for law enforcement. It's a lot of work for investigators to investigate those cases. So we're seeing the impacts of that, but not necessarily an increase of funding.
Brittany, you mentioned earlier a time frame, a 24-hour response, 72-hour response. I assume that's based on the seriousness of the report.
Correct.
Is there any, like, I'm coming from a child protection world, we track that kind of thing. Mm-hmm. Do you have data related to how quickly your staff are able to respond, or maybe you guys hold some of that information about how quickly workers are able to get out to do these investigations?
There would not be formal data in SSIS necessarily about, or a way to run a report about how quickly we're getting out to see the person.
Okay.
But we internally have a way of tracking that just by use of our checklist where we're writing down the dates for each task that's being accomplished so that we can keep track of where we're at in each investigation.
But so that's manually tracked?
Yes.
Okay. Beth, what about from screening? Like, we would track timely screenings in child protection. Do you have a mechanism to track how timely the reports are screened?
We haven't really been tracking that, I don't think. There's not a report in SSIS tools, I don't believe. But what I can say anecdotally is that we thought up until probably a year ago that we only had 24 hours to screen, which in fact we have got up to 5 days. So we had been historically screening with the idea that we only had 24 hours. So I'm guessing
We're meeting it.
We're doing pretty well.
we're doing pretty good, so.
Nice, okay. From law enforcement, do you see delays? Or are there barriers to, like, you both spoke so highly of our staff, and we're really appreciative to hear that. Are you seeing delays in being able to respond to these reports?
We're not. I mean, I received the mark reports by email, and as soon as I received the email, it either is assigned out to an officer to take right away, like a regular call, or I would take it myself. And some of them are a quick run up to the Lutheran home to say, this was an eyewitness fall. Are there safety measures in place? Yes. Okay. That case is over. 20 minutes done. Or the financial exploitation cases that we receive in, those are month or 2 month long investigations. And they have to be started right away it takes a long time to get information, so there is no delay on our end. What do we do?
And, you know, the only delay I kind of noticed, and it's just the reporting system from us to you, you know, when we're reporting to adult protection, with child protection, we will send you just directly our police reports. Now we have to send them through Mark and fill out their forms, and then they send them to Scott County. So instead of being a direct access, there's, you know, a little roundabout we have to do. So that would be the only delay. But once we both have the cases, no, we have several investigators, and we put them at a high priority, and there's no delay after that, I would say.
Okay, thank you.
And we haven't, I think we do a very nice job of getting out there as soon as possible and meeting those immediate deadlines. I think where we struggle in meeting the deadlines is substantiating or unsubstantiating a case, closing the file. We are behind in a lot of those timelines just because of our volume.
Okay, thank you.
I'm curious on page 7, the findings for adult protection cases open. I guess my question is, what did these numbers tell you? Is this the right mix? Is there a wrong mix? You know, so I was just curious what you see when you look at this.
Well,
Go ahead.
I was going to say, I mean, the first thing it says to me obviously is growth. We're growing like
Right.
crazy. As far as the makeup of what our findings are, is that what you're referring to?
Right, so I mean, it looks like if you look at 2016, 15 were substantiated, about 74 were fall in the other categories. Does that concern you, or is that just the way it falls? And
I think we're right on par, and we have had some conversation about this particular snapshot because of how the breakdown occurs. But if you will look at page 10. So page 10 talks about the percent of adult protection findings that were substantiated. And so for Scott County, we're substantiating about 15.9% of all the reports that we're investigating. The state average is 9.9%. So if we're doing a comparative that way, I believe we're right on par as far as substantiating cases.
Okay.
Not that our goal is to go into an investigation to substantiate.
Right.
But if we're looking at the comparative data, I think we're doing exactly what we should be.
I think another thing this tells us is if you look at the pending cases, so on page 7, there are 62 pending cases. That tells us the workload that our investigators currently have open that they are working to come to a resolution on.
Well, and on that same point, the 62, it's actually findings that we're investigating. So I believe we have 45 actual cases that are open currently, but on each of those cases, they may have more than one allegation that we're investigating. So this is a data point of each of the allegations that we're investigating rather than the total number of cases that we have open.
There has certainly been a rise in cases, but I noticed there's been a rise in false cases or inconclusive, or it's not a vulnerable adult. Is there a pattern that you're starting to see there of what is causing some of these false claims or unsubstantiated claims?
I would say that, you know, our screening, again, our screening process has changed. So I think we're capturing, anybody can make a report. So anyone in the community can make a report. It could be an upset family member, it could be anyone. And when we're making a decision on whether to screen in or screen out a report, we're going off of what this reporter has relayed to us. It may not be true, but it may be. So if the report meets our criteria for completing an investigation, we're going to start an investigation. So I think what this tells us, from my point of view, is we're doing more thorough investigations, and I don't think that the fact that we have more false substantiations says anything negative. I believe that just tells us that we're completing thorough investigations, and even when we are doing an investigation, the finding is false, we've had a lot of engagement with that person, and have been able to offer resources, safety planning if that's needed. So we're engaging them and offering a lot of service in the meantime, even if the report that we received turns out to be false.
I think we can also make the connection to the central reporting line and the community awareness that's taking place, which I think we can say has been quite limited, but DHS has done some work to reach out to the community at large to say, here's a resource available to you if you suspect there's an abuse taking place. And so we're seeing more members of the community as opposed to people who are trained mandated reporters making those reports, so they might be less familiar with the criteria around what would constitute an investigation and a substantiated claim.
Go ahead, Jake.
Yeah. On page 2, you highlight a few missing links in service integration. And as adult protection as an agent, functioning as an agent of the Department of Human Services, the the second and third bullets there, statewide system integration. Could you talk a little bit about what that means and how statewide system integration might benefit the people you're trying to serve? And then any related policy gaps there, because this is an agent of the state.
I think we've just seen when we compare to other systems in health and human services, there has been, I would say, limited attention to adult protection across the state. And so we have very limited amount of data statewide to compare to. We just recently, this is the first year that we've gotten data to show what other counties are seeing as far as substantiated cases. We don't have things like a statewide mortality review in the event that there is a death that takes place, as is the practice in child protection. There's just, I think, a lack of resources statewide to address the needs of protecting vulnerable adults. And so we have tried to advocate for mining some of that data statewide and sharing it with us so that we can compare and improve our practices. We've also, I think, identified some policy gaps. We worked with our county attorney's office, for example, recently to identify some language barriers that allows us to do safety planning with individuals and engage members of their family or support system in asking them for additional support or information. So we're working with the statewide work group to try to improve that policy so that we can ask those questions, share that information when it's essential for the adult to be in a safe situation.
I would also add in, as far as public health nuisances, the state law, statute chapter 145A delegates local health boards to take care of public health nuisances. And so currently the only piece for public health nuisance that Scott County has is in terms of clandestine meth labs. And so there's a bit of a gap there because it limits us into as far as what we can do and how we can interact with those residents.
That's the question I had on page 11, the number of public nuisance cases. You mentioned hoarding earlier, but this isn't necessarily all hoarding nuisance calls, is it?
No, these could be related to other subjects, but the majority of them are related to They're generally from family members who are concerned about an aging parent or potentially a neighbor. They've got so much stuff and they're hoarding. I can't tell you if I walk into a house if the person who lives there has hoarding disorder, but I can tell you if the home has been hoarded. So there are several other comorbid things, including physical limitations and and the mold and bed bugs and pests, those all go along with hoarding, so it could be part of.
And once you've made a determination that there's hoarding, does that then become a caseload for investigation as a vulnerable adult?
It can. If they meet the other vulnerable adult criteria, it certainly could become an adult protection investigation that we would then want to work with our counterparts here to help solve, because they are very complicated cases.
It goes along kind of with my question. So what is public health's role in that? So if you walk into a house and you suspect there's a hoarding situation, what are your next steps within public health? What is your role?
So first, I think that we would assess the need to make the report to adult protection and the residents' immediate safety, and any concerns that they have in terms of their concerns for their situation and our concerns for the situation. So addressing their health needs, but then as well as evaluating, I guess, the safety for surrounding neighbors and anybody who might come into that home. So we might provide resources for people who live in these homes are very isolated and they're very embarrassed of their situation. So often they will delay maintenance on their homes. That's where the mold and pests and things like that come in. So we try to kind of be a resource navigator for them and try to kind of pave the way so that they can get some of the issues taken care of within the home.
Brittany, can I just clarify, is that data specific to the elderly population, the number of cases, or that's across the population?
That would be across the, do you mean elderly specifically?
Right, so
65 or-
on page 11, so in 2016, were the 10 nuisance calls, were those all integrated with adult protection, or would those have maybe been other people in the community?
Other people in the community.
Okay.
So they might find us, who knows how they find our number, but they identify it as a public health issue and directly call us.
Okay. All right. Danielle, can I go back to something you said about just sort of the lack of attention and maybe not the development of data around some things that you might find helpful in this program area? Are there specific things that would be good markers for you of, hey, we're doing a really good job in this area? If we could get this data, it would help tell us that.
I think, as Jake mentioned earlier, being able to identify repeat maltreatment outside of that 6-month range, I think, just being able to compare our numbers to our other counterparts in the metro and outstate Minnesota, that would be huge for us, because I think a lot of times we struggle with, did these tell us that we're doing a good job? Are we doing okay? And I think we've had a limited ability to be able to analyze that because our numbers have been so small. When in 2011 you have 16 allegations,
right,
it's hard to make some general assumptions, whereas now we're getting to the point where we have higher numbers where we can make some inferences about that data. But I'm trying to think of some of the questions we've asked the state. We've asked them questions around in cases of someone passing away, what types of maltreatment took place there, how do we compare to other communities there. We actually have a practice in Scott County where we will do a mortality review if there is a death of somebody who has had an open investigation. That is not the case across the state, and it is not a requirement, so it's something we do in addition, and we certainly learn from that. But we can only tell what the common themes are in Scott County. We can't necessarily say statewide, here's some changes to the system that would help impact.
Okay. In law enforcement, do you have better data, better access to data, numbers of adult protection cases, types of allegations?
Yes, all those would be tracked. Anytime a case comes in, we pull, it's like a case number, an ICR we call it, and all of those are tracked, and we have different types of outcomes where we're similar to you guys, I think. But yeah, we have access to that.
Can you break that down by police jurisdiction? Can you look at where these, because it sounds like most of what the data that you have is manually collected.
Well, all our data, we're on the same database. It's through Scott County. It's the LETG, so
Okay,
it is data that can be shared and pulled, and
okay,
yes.
okay.
One of the other gaps I think that we've acknowledged is we can tell the reports that come in, but we don't know about people who are experiencing potential abuse in the community where that's not reported. And so one of the things that we would like to expand on in the future is doing some community education and awareness of making sure that people are aware that this is a resource and that there can be a response. Also, hopefully we would be able to offer that adult service, that kind of step down extension of services for people who don't yet meet this level of need, so that we could really get a handle on some prevention measures, so that we're not just coming in when it gets to a certain point, that we're preventing people from experiencing the abuse
Sure.
Before it happens.
Sure.
Are there resources available to direct those folks to? So if they don't meet the screening criteria, but probably have some issues going on, and we don't have the capacity to do the adult services at this point, are there resources available in the community for those folks you can direct them to?
Sometimes.
Yeah, sometimes during our screening meeting, we'll review the report. It clearly doesn't meet the level of an investigation, but there's a need there. Oftentimes, intake will send out a letter to say whether the report has been accepted or not. And if it's not being accepted and there's a clear need, like for a MinChoices assessment, for example, they'll put in some information about how to call and make a referral for a MinChoices assessment or something like that. So we certainly have done that on occasion.
But we do have others that will sit kind of on our referral list for an adult services case and be waiting for some support. And as Brittany mentioned, with public health, a lot of these cases, folks tend to be isolated, and so that does require, I think, a level of engagement that's difficult to establish if you're just making a referral to another existing service.
One other question. We go to page 7 again, please, Deb. So I've tried to put myself in the shoes, I'm not one, but put myself in the shoes of a Scott County resident, either watching this or encountering this information at some point, that from 2013 to 2015, the number of cases open doubled approximately, and from 15 to 17, that number doubled again. We've talked a little bit about the demographic shift and that the population, more 65 plus, more 85 plus going forward. Is this just we see no end in sight for this trend? My experience in Scott County is that there are a lot of good Samaritans here who care about their communities and want to have a role in helping. So from a community education and advocacy standpoint, what would you want the residents of Scott County to know, and what role is there for a would-be citizen advocate? What can they do to help out?
I would say from the law enforcement standpoint, it's if we can get cases going through for financial exploitation where people are being held accountable for their actions, then it would be more of a media output of, if you do this, there's consequences for your actions. If you have elder abuse or neglect and you're charged with it, there is an outcome for that. And County Attorney Barr has been very helpful, and we've got some cases going through now where we are seeing, charges, felony charges coming through. So from a law enforcement perspective, that would be helpful.
I think training, people have talked about training a little bit too, and I'm starting to see that with bankers and other people in the community too. They know what to look for, and they're stopping, the senior citizen comes in and wants to, transfer these funds and say, well, maybe you should go down and talk to somebody at the police department. And we've got several of those cases where people are identifying these before they happen, or at least, it's not repeatedly happening. So that aspect, and obviously that's going to increase your reporting numbers there too, and I think that's what you're seeing some of that there is, but continuing to train, other people in the community to help identify these, these potential victims before it gets to the point where they're losing money, which is, in our role, it's very difficult to retrieve that money because a lot of it, not only leaves the state, it can leave the country, so.
I would advocate for a different approach to specifically hoarding in terms of stigma reduction. The shows have really, they exploit the emotions of the residents, and generally the cause of hoarding disorder is related to grief, loss, or trauma, and so I would advocate that community members exercise compassion and reach out to these individuals and ask how they can help without shaming, and get appropriate, make appropriate calls as needed.
And I would say the best resource we've seen as far as safety planning is when you've got the community members that are already engaged in providing some type of informal support for the vulnerable adult that we're working with. One of the cases we recently were investigating, it will fall into this green category where the report was false because someone called with concerns about, this person was not receiving care. And shouldn't be living alone, but through the course of an investigation, we come to find out there's lots of community members around this person that are supporting them to live in their home safely. So that report was false. But that's a great way for community members to get involved and to help this growing population. Just be involved with your neighbors, be involved with those at your church, offer assistance.
I know that Belle Plaine Police Chief Tom Stoley has a PowerPoint presentation that he brings around to our elderly people that live in our facilities, where he will go through and talk about the new scams that are out, new frauds, what to do if you get a phone call. We have several people that will bring in mail that they get. It's a fraud, obviously, but they feel compelled to give money, and through that training, we've kind of stopped a lot of that fraud from happening. So, us getting out in the public and saying, don't send money for my kid is in jail, or whatever fraud call they get. It's don't send the money. We've seen reduction there. So.
Do you have, you folks talked about hoping to add a staff person in 2018. In addition to the staffing piece, do you have best hopes for where this program goes? What are your next pieces of development?
I mean, I think that we absolutely hope to have an added staff person so that we can address the investigations timely. We hope to be adding that adult service back into.
So adding that back in?
Adding that back in so we can provide some long-term planning and supports for people who either don't meet that criteria or who have stepped down from that criteria. We hope, I think, to be engaged on a state level as far as advocating for policy changes and best practices and kind of developing that, informing that system. And I think we really hope to continue to engage this collaborative group to make sure that we're moving forward as a partnership and addressing things as they come up.
And I would just add to that, yes, everything you just said, but, with the addition of staff resources, we could also potentially start working on some of these community education pieces that we're already talking about. Going out and meeting with seniors, maybe even in partnership with law enforcement about how to not become the victim of a scam. But also working with banks on what you should be reporting, and this is how we could work together to prevent funds from being exploited from a vulnerable adult. So I think the community education piece we could also hope to add in as well.
Okay. So really a lot of focus on trying to prevent people from getting into those situations to begin with. Mm-hmm. Okay. Are there other panel questions? I wonder if we could stop and ask for questions from the audience.
I have a couple questions. I'm loud. And I'm not sure if this is to Brittany or law enforcement. I'm kind of curious, where does fraud fit into this? And do we have good collaborations with our economic assistance department in the fraud? Because I know I have seen certainly things come by my desk where we've had people, large sums of money coming out of people's account. And from an economic assistance perspective, they're looking at it as potentially public assistance fraud, but I also think there's potentially some overlap there with being vulnerable adults and kind of, do we have them at the table? Do we have good partnerships there?
We've definitely received referrals from financial workers or have had a financial worker call and say, this doesn't look quite right, would this be a vulnerable adult report? So I think in some cases that's happening. My understanding is that they're also doing an annual mandated reporter training so that they know what to look for and when to make those reports. But as it goes with anything, like this collaboration that you have right here in front of you is fairly new, it's still in development, and there's always room for growth. So that is certainly something that we could look at for the future as well.
All right, my other question was a data question. It really related to page, oh, excuse me, just one second. 9. This is like all over the map, which just kind of surprises me. We range in terms of the percent of adult protection reports investigated from a Wright County at 80% to a Hennepin County at 15%. Any sense on why so much discrepancy? It looks like we're right around the state average, so that's probably good, but why such disparate numbers?
So, and Beth, maybe you can chime in here too, but, so I'm focusing on the Scott County number of 30% compared to the state of Minnesota average, which was 29%. So that tells me we're doing what we should as far as reports that are investigated. Just anecdotally and just from our network, I know that other counties have different screening practices than we do, and I think that's what you're seeing here. I think that's what's reflected in this data. Just a different way of screening in reports.
So comparing it to the child world, where I think there's fairly clear screening criteria and I believe more consistent practices. So is this kind of one of those policy pieces that really aren't there in the adult world?
I think just the vulnerable adult criteria, it's pretty gray. So we do have criteria, it's bulleted out, but it can be interpreted different ways. I was really fortunate enough to take the investigators in August to a national conference in Milwaukee. So we were there for a week. We were just listening from other states on how they do things, and the statute in each state is different. In California, for example, their statute is if you're over the age of 65, I believe it is, you're a vulnerable adult. That's pretty clear. You are, you aren't.
That's not nice.
Exactly. And then I want to say in Colorado, it's even younger than that. But for ours, there's much more criteria that goes into whether you're a vulnerable adult or not, and so there's a lot of interpretation there.
The other piece that we've kind of run into with the child, we need harm. I mean, other than some threatened sex or some threatened injury, I mean, we usually need harm. Where we've had some, I think, good conversations and where I think we've done a better job of screening things in is did harm happen or is it likely to? And it's that, is it likely to, is where we end up having some really good conversations, and I think probably have taken some that, yes, probably ended up being false. But you guys have had the opportunity to go out there and offer some services, engage with these people, and hopefully, I mean, I think that's a piece that would be, I don't know how we'd ever track that, but did those people ever come back in, or were you able to, make sure that there was no maltreatment down the road on those? Because that's a piece that we didn't do until we had the adult protection team kind of sitting down at the table with us and kind of changing the way we were looking at. We were doing too much of a child protection focus, and the adult protection piece, that likely to pieces, it opens up the door to a lot of different interpretations.
This is also very new data. This is the first year in 2016 we were able to see that connection to some of our other partners. So Wright County might be looking at this going, or, I mean, my hope is that the state would be looking at this and saying, clearly we've got some inconsistencies here that we need to look at, and so we need to develop some practices that leave it less open to interpretation. Because I think when you are leaving that gray out there, there's some ability to change your response based on, things like your ability. So Hennepin County might see a huge volume, but they're only able to respond to 15, and so they're prioritizing cases based on that. So hopefully we'll be able to see some implementation of some statewide practices that would impact this moving forward.
I'm just trying to understand, when people are being screened, do you just go off of the report that was called in? Or are you actually contacting the supposed victim? And I suppose some people might interpret that different between a screening and an investigation, depending how much work has to be done on those. What do you do when you screen versus investigate?
So the screening, we really are just looking at the report that has been called in. On occasion, if we don't have enough information to make a good decision based on that report, intake will call only the reporter to try to gather additional information. Because if we're moving into contacting the victim or the vulnerable adult, that's an investigation. That's changed gears. And we don't have the legal authority to do that unless the person meets the vulnerable adult criteria and we have, and it meets the criteria of maltreatment. So we have to walk a fine line in getting as much information as we can to make a good screening decision, but sometimes we are quite limited with the information that we have. So, for example, if we have a good amount of information, but we're just not quite sure, but we have enough to tip the scales in the direction of an investigation, we'll open it for an investigation, because we would never want to rule something out and have it actually be something that we need to be checking into. So through the course of an investigation, then the investigators can ultimately make the determination of if they're not a vulnerable adult, that is one of our findings. So we can close the case as they're not a vulnerable adult. But at least then we've done our due diligence to make sure we're making every effort and doing everything we can to protect that person and do a good investigation.
And I think too, the statewide system has been good for people to have a central entry point. That's been great. But I do think that we missed something, not having our screeners taking the calls and interacting with the reporter. I mean, they're incredibly skilled, and a lot of these reports are coming in and they're anonymous, or, there's not a telephone number to call a reporter back, even if we had questions. So, it limits our ability, to screen things more thoroughly.
Other audience questions? Mr. Chairman, can we turn it back to the commissioners?
You certainly can. Thank you, Chris, and the panel members for the discussion. I have just one question, and then I'll open it to the panel for comments or questions. We're looking at the rapid growth in caseload or reports. I'm wondering if that is because the state has changed the standards of what must be reported. I mean, I know we've had some population growth and so on, but one of the comments that Sergeant Steyer made about all of a sudden a fall at the nursing home requires a police visit. I'm thinking when my wife worked there, I don't recall that was the case a few years ago. So I'm wondering, and it may be a rhetorical question, if some of the increase in the number of reports, especially as dramatic as the increase we see on the chart, I think it was on page 5 or 7, is because the state has given it some attention and changed the standard of what must be reported.
I don't think that has largely impacted our numbers as far as what's required to be reported. But I don't know if these guys can speak differently to that. Potentially, is there a difference in what law enforcement must respond to? I think there was some shift in that with the central reporting. In that the number of reports that maybe were directly sent to law enforcement has increased because of that policy change. But as far as the number of cases that we're investigating, it would
For us, it's dramatically increased for child protection and adult protection. I mean, child protection, I mean, greatly increased in adult protection, also the amount of cases we're getting in our department.
Mr. Chair, can I make, and maybe Jen was going to point out, one thing that I want to point out is that the 122 are not, that our adult protection unit are investigating, are not necessarily the reports that law enforcement are going out. Our unit is primarily involved when it involves a family member. We do not do facilities. So I
Okay.
just want to make sure we have that distinction.
Thank you, Pam, for the clarification. Is that the point you wanted to make?
Yes, yeah, we're not running to the Lutheran home for someone to fall, so that's not, we go there a lot, but not for that.
All right, thank you for the clarification. Further questions or comments, observations, members? Mr. Brecky?
Sure, I always have a bunch, but I'll put them in writing too. First of all, with the central intake line, if people call here, if they call third floor, if they call police department, do they have to be told to call a different number? We can't transfer them, that type of thing? I'm just wondering, because I know it's hard even for people to find who to call the first time.
Sure. How are you handling it?
Yeah, well, I think, our direction has been is to have people call the central intake
Okay.
line, yeah.
So they have to actually give them a new number. We can't help you call this number. Okay, just wanted to see in my head how that works.
And a lot of our calls and reports, a lot of them come from law enforcement, a lot of them have come from facilities. I mean, that, the facility calls, that's been kind of a nice thing, because we haven't had to, man those anymore. But
Right.
it just took a little bit of education for them to realize that they needed to call that number, but.
Right, but I think one of you said that it seems that there's more calls coming just from community members versus mandated reporters and those things. So I was just thinking about the customer service of that. And then I just have a question on the data before I forget it. Now I'm going to find this. So if I look on page 9 and it says Scott County, 30% of adult protection reports investigated. But then I look at page 8 and for 2016, it says 24.3% screened in. Is investigated and screened in not the same?
It is the same, and I think the difference that you're looking at is that we've gotten data from two different systems. So on page 8, this is our own internal system, our SSIS report that we've generated that number from. But on page 9, this is data that we've gotten from the Department of Human Services. So that's where the difference in numbers is coming from.
So which one's true?
We would err with our own internal numbers.
Okay.
But we don't.
Good.
Yes, but I would not want to put our 24% of reports screened in against what DHS is reporting if they have a little bit different way of collecting data. I'd prefer that to be consistent with other counties.
Mm-hmm. Interesting. All right. And then my other question just had to do with employee caregivers, but it sounds like we are never investigating an employee caregiver, even like in a small group home. That's always a state issue?
We would not be investigating a caregiver in a facility, but if they're a PCA, a personal care attendant, we could be investigating them.
Thanks. Thank you.
Only if
you.
it's a family member?
Not if it's a family. Either way.
Either way.
Mhm. Wouldn't have to be a family member.
Okay. Further questions or comments? Well, Chris and team, thank you for standing in today. Thank you for the work you do on behalf of our most vulnerable and our behalf as we represent the citizens of Scott County. Appreciate it very much. Thank you.
Thank you.
Members, that brings us to the point on the agenda where we're going to entertain a motion for